Perfect. Okay. So here is an overview of what, oh, hold on one second. I just need to make sure I can transition the slide. There we go. Thank you. So here's an overview of what we're going to be covering today in the hour that I have with you. First, we'll have a quick overview of Notre Dame's international response to COVID-19 to date. Next, we'll talk about how Notre Dame assesses health, safety, and security in a COVID-19 world, and what that means for the selection of programs that might be able to run versus those that might not. Next, we'll talk about what might be different during your time abroad from what you had expected your study abroad experience to be based on the current health and safety environment with COVID-19. How you can best prepare yourself to study abroad starting now. And what if you have an emergency while you're abroad? What does that look like? What is the support and safety net around you when you are on international travel with the university? So to start, we'll do a quick summary and overview of Notre Dame's international response to COVID-19. As many of you are aware, this past spring, in around mid-March, the university made a very difficult decision, but the right decision, to cancel our study abroad programs and bring our students, faculty, and staff home. It was over 500 individuals that were brought home. The vast majority, all but one, were able to return on commercial flights. So many of you may have heard that with border closures, the State Department has provided expatriation flights to, or repatriation flights to back to the United States for US citizens. All but one student who was a graduate student that came back much later was able to return by commercial means, and that was at the expense of the university. We made the next decision to suspend summer study abroad. That was an easy decision based on the university, of course, being closed. And then in early June, again, made another difficult decision to suspend fall 2020 programming based on the current health and safety environment, not only in the United States, which was worsening at that time, but also abroad where many restrictions were still in place. And currently we are planning and assessing spring 2021 and plan to make a decision hopefully around mid-October to inform you of what those next steps are. Next, we're going to talk about how the university makes those decisions with full transparency here. So what does this risk assessment and mitigation process look like for Notre Dame International? We have main risk categories, which we're going to run through currently just right now, and then we'll dive into them a little bit more on the next slide. First, we look at the country level risk. Again, we'll talk about that in just a second. The COVID-19 medical risk and impact. Preparations of our provider or partner organization overseas, which in some places that like our gateways might be the University of Notre Dame itself. Response and contingency planning to make sure that we're prepared for all emergency situations, including the pandemic. And essential education for our student travelers and essential preparation. So how do we best prepare you before you travel and then also on arrival at your destination? So let's unpack these just a little bit. As you can see, this is a lot, and this is just a bird's eye view of the risk matrix that we use. So those are the key risk categories at the very top, and all of those are risk indicators down below. And again, there are some more that aren't included in this, but these are the main buckets that we're looking at here. And so I won't go through all of these, but I will provide you an overview of, all of them are very important, but the overview of what the most important ones I think I would consider, of course. So I think starting at the first column on the left under country level risk, you'll see travel advisories. These are very important, not only because it's what the State Department and CDC, US governmental organizations, what they're advising US citizens, organizations, and universities like Notre Dame, what they're advising us with respect to travel overseas. But they're also rooted in our international travel policy for undergraduate students. So we do follow those very carefully. And until recently with COVID-19, we weren't running many programs, if any, in high-risk locations. That being said, on August 6th, the CDC and State Department lifted their global health advisory that basically said since around mid to late March up until August 6th, U.S. citizens in the U.S., reconsider or do not travel abroad. It's a recommendation. There's not a ban, of course, but as you know, there's many locations around the world that are not allowing U.S. citizens to enter. So this ban, this advisory, this global advisory, was lifted on August 6th. And what happened is the CDC and State Department reverted back to their country-level risk assessments. It wasn't just the global advisory, it reverted back to the country risk assessment. So they're really looking at what's going on in that country with respect to COVID, with respect to other health concerns, maybe malaria or other types of disease that are prevalent, but also safety and security concerns, protests, terrorism, crime, all sorts of things like that. So they're looking at that local and country level again. The next thing I think is very important is what the university's emergency assistance provider says about travel and whether or not travel can resume safely or not. They might say it's safe to go to this place. They might say that, exercise extreme caution or do not travel to this location at all due to the entry restrictions that are currently in place. So we listen and weigh that very heavily as well. And there's a number of other country level risks that I think are very important to ask, because if you cannot get a flight because flights aren't available, obviously that's not a country that we can send students to for a program. There not only needs to be one flight available, there should be multiple flights, and preferably on US carriers at least. If you need a visa to study abroad, if those embassies here in the United States are not yet processing those visas and we do not have a timeline of when those are going to resume, that's obviously problematic for those specific study abroad programs. If you are allowed not only to enter that country, so for example, the UK and Ireland currently, you must quarantine on arrival for 2 weeks. In other countries, they are not accepting US citizens, like I mentioned, but there are some countries in the last month or two that are granting exceptions for student travel and for educational purposes, which we're monitoring very closely and keeping a very, very close eye on a day-to-day basis. So once you're abroad, are you able to also return? So for people that are returning from the EU, for example, if you're a US citizen, you can return to the United States after the conclusion of your program. However, if you are maybe perhaps of a different nationality, you might not need to return, might not be able to return to the United States at the conclusion of your program. You may have to go to your home country or somewhere else. So there are a lot of things here, I think, of this country level risk assessment to consider, notwithstanding the whether or not the U.S. Embassy in that location has resumed operations besides emergency passport services and visa services for U.S. citizens abroad, and then whether or not there's any emerging concerns related to COVID or born out of the COVID-19 crisis. So not only here in the United States, but elsewhere, there have been an increased level of protests. There might be increased levels of crime in certain locations because of the high unemployment due to the COVID-19 crisis. So there's a lot of things I think to unpack here and what we're keeping an eye on a daily basis here at Notre Dame International. I think the next most important category too is the COVID-19 medical risk category. And when you look at that, we look at first the medical entry requirements. Of course, if you can enter a country, that's wonderful, but that might not be the only thing that you need to enter a country. You might need to, again, quarantine on arrival for 2 weeks. You might need to register or download a contact tracing app that government requires you to have. You could also need to present a negative COVID test on arrival. You might also need to have a COVID test when you get there and wait for the results either in a quarantine space that the university or a partner organization provides, or maybe at the traveler's expense at a government facility. So again, a lot of things there to consider. Also on your return, like we talked about in the previous category, are there any medical requirements for you to re-enter that country? So in the US, the CDC just revoked their recommendation for 14-day quarantine upon return to the United States after international travel. But that's the United States. If you're going somewhere else after your study abroad experience, that's something to also consider, and it could also throw a wrench in some of your plans. One of the most important things I think in this category is the COVID-19 country data for that specific country. So with the 20 plus, 30 plus countries that we send students to in the spring, there's a lot of data to comb through, and that's the number of total cases, the number of deaths, the trajectory of positive cases, not only over a 14-day period, but week over week consecutively for 4, 6, 8 weeks. So we can understand if there's a downward trend, and whether or not the national government there has responded appropriately. Were they able to act very quickly to stem the spread of COVID-19 in that country? Are their current lockdown restrictions still in place? Have they begun a phased approach for reopening their country, and where are they at in that phased approach? It doesn't make much sense for us as a university and for you as a student who wants to study abroad in a different country to send you there to only be able to study remotely and not leave your dorm room. So we take that very strongly into consideration. And whether or not the healthcare structure in that country has the capacity to handle another outbreak. We want to make sure that that standard of care that our students are very much used to when they study abroad in that location has not changed, and that healthcare system has the capacity to not only support routine care, somebody has the flu, they need to see a doctor, they won't be turned away, but also emergency care as well. If you have an appendicitis, those types of things, we want to make sure that they also can be addressed immediately. The efficacy of testing is also extremely important here on campus. Obviously, we're very blessed with resources to be able to stand up our own testing site here. However, in different countries, we're at the mercy of their healthcare systems, of course, and the types of tests that they provide. And we're also on their timetable. So we take a very close look to see what those schedules are like for not only being able to get a test, what the wait time is like, and then when you ultimately do receive your tests. So that's also very important. Your insurance is also extremely important for your healthcare. We require all of our undergraduate students to enroll in international insurance with our preferred partner, GeoBlue. We're going to talk about them in just a few slides, but they will cover 100% of medical costs overseas. Again, just hold tight. We'll talk about that in just a second on a couple of slides. And of course, we want to know that there's PPE, hand sanitizer, and other necessities that you might need while you're abroad readily available to you. To kind of breeze through some of these as quickly as we can, we'll just move on to the next risk category, preparation of our provider and partner organizations. Most importantly in this category, we need to understand and confirm that our providers, our exchange universities, even ourselves, Notre Dame, as the program provider, say in London and Dublin and Italy, that we have taken the appropriate actions based on national guidance in that country, and also with the approval of the university here in South Bend, that we have taken every appropriate action to limit the exposure of COVID-19, limit the spread of COVID-19 across all of our controlled facilities. So for example, in London and Fisher Hall and in Conway Hall, all the types of structures that are in place, signage, PPE, are all to our very high standard. That there's a cleaning regimen that we have approved, that they will enforce social distancing measures and the use of PPE, just like the university here does, that they have very strong quarantine and isolation protocols similar to the university standard here that include things like providing quarantine and isolation housing, food, Wi-Fi, and other care and well-being resources. That there is also a local preferred medical provider, whether that's an on-call doctor or a private hospital that our students go to. We want to make sure that there's a strong local health partner readily available to support our students while they're abroad. And we generally have that in every location that we send students to. So please keep that in mind. And also, we need to understand at the country level with our provider partners and organizations what the treatment of COVID-19 looks like in that country. In some countries, COVID-19 positive cases can be only treated at public hospitals. In other countries, they can be treated both at public and private hospitals. So we obviously have a preference for private hospitals in most locations because they just have a very much higher standard of care that our students here in the US are accustomed to. But those are also very important risk indicators that we look for in doing this assessment. Other things in this topic here is just, a review of the public transportation system and availability of public transportation in that country, whether or not it's changed with COVID-19, as well as a review of sponsored excursions or field trips that might have been planned to make sure that they're accounting for social measures that should be in place based on their national guidance. And also to make sure that they have a COVID-19 specific or have worked in COVID-19 details and so they're on a site arrival orientation for our students. So not only are you getting that information from us here, so we know that you are prepared to have received that information, you also get the local guidance on the ground from those local partners. Lastly, it's very important for every partner or organization and provider that we do have is that there's clear defined behavioral expectations and consequences for not following rules, just like there is here on campus. We've seen what's happened over the last couple of weeks when there aren't those clear behavioral expectations and consequences. And, we would never want to put our students in a situation knowing that without those, things do happen where the virus can spread amongst our community, put that program in danger, put that semester in danger for our students. So those are very important considerations. And then lastly, with response and contingency plans and student education and preparation, just making sure that the emergency plans of preparation are really zipped up tight. There's every kind of emergency contact readily available that the university here is aware of, that there's an emergency communication process in place, not only for the students that are locally to understand from that provider or partner that there are maybe local cases, that there might be local cases within our own study community, and how to relay that information to the student, how that student can then ask questions. And so there just needs to be a robust communication protocol. And again, academic continuity plans, just like there is here on campus this semester, it's very important for any program that runs in the spring to have very similar or comparable academic continuity plans in case, there might be a spike in cases, which might lead to a local lockdown or students that maybe really just can't go to classes. Just like here on campus, it's just not safe for them to do so, so they might revert back to 2 weeks of remote classes and then resume classes in person at a later date. We'll talk about the student education and preparation in just another slide, so we can just continue to move on and press on through. Okay. I think this slide is very important about expectations versus reality. Many of you signed up for applied for study abroad programs, perhaps before the COVID pandemic, maybe during the pandemic before it got so bad. And so there may be some changes that are beyond Notre Dame International's and also your control that could impact the type of experience you expected to have overseas. And we want to be very honest and straightforward with you that, again, these are out of our control. They're certainly, definitely out of your control. They're out of everybody's control, and are really based on the local environment that changes, as we know, on a daily and weekly basis at this point. So with this comes the obvious first answer, which is travel restrictions, red light, green light. There's no longer a green light for students that study abroad to want to hop on a Ryanair flights for the weekend and hop over to another country. That's just no longer a reality. We obviously have limited traveling capabilities here in the United States, and it will be the same when we go overseas as well. Especially if you must quarantine on arrival or be tested on arrival. That is something that we take very seriously. It's something that you should take very seriously too. And so if you need to quarantine on arrival after leaving the country, that is just something that is not going to be an exceptional excuse to miss courses, and so that's something that's just not going to be excused. And so that's something to just take into consideration. We're not saying that to deter you from studying abroad. It's just trying to get at the seriousness of the situation. And we want our students to have a very fulfilling experience while studying abroad. But this semester coming up, it might be just slightly different for some of those programs that do run, which Notre Dame International sees that as an opportunity for our students to really immerse themselves and see the country that they are studying in from the top to the bottom, and see everything that they can as much as possible, and to really embed yourself as a local. There might be some societal restrictions still in place. While a full lockdown might have been removed, if you were expecting to go to a pub and be surrounded by 50, 60, 100 friends and new colleagues, that just is something that might not be possible. It's certainly not possible here in South Bend. There are still gatherings on the size of gatherings. So that could be something that you could be faced with in your program location. In addition to obviously having to wear masks, those are very much mandated in many of our program locations, and something to be mindful of as well. There could also be cultural attractions that are closed. So if you were really looking forward to going to a certain museum or to see a certain sort of tourist attraction, these could technically be might be closed during that time you're abroad, and we hope that they're not closed for the entire semester, but there could be limited operating hours or complete closures that you should be aware of as well. Events could be canceled, like live shows, concerts, things like that you might have been looking forward to. Also, your ability to have visitors could be very limited or non-existent. Many of our students that studied abroad previously would have family members come visit them, or friends from Notre Dame come visit them. That might not be possible just because of the restrictions that are currently in place. If you, for example, enter a country under an exception because you're a student and you're studying for educational purposes, that's quite different than trying to enter as a tourist that maybe your friend or your family would be trying to do, and they would be denied essentially. And so we have to keep that in mind. And in specific countries like China, those restrictions are very, very set in stone at the country level, and then also reiterated at the program level too with some of our partners. So just again, something to keep in mind. We also don't want to contribute to the spread of coronavirus. And so that is one reason why the university here is asking our students, faculty, and staff to not travel during this semester, because we want to preserve the bubble that we have here on the Notre Dame campus and keep that as safe as possible. And then lastly, just like there's testing here on campus, there's daily health check requirements as well. Those things are likely to continue at your program and provider locations. And so just something to keep in mind, you might be required to do another daily health check like your Notre Dame daily health check. You might be able to have to do that twice a day depending on the country or the program. And then this type of like surveillance testing and periodic testing that does happen as well. So all things to keep in mind. We do still believe that a very enriching study abroad experience can occur, but we also want to be very honest with you that this is an unprecedented time. And also these things are all, being told to other students that are studying abroad at other universities, well, that are interested in studying abroad in the spring. This is just a reality for any student that does want to study abroad, and we want to be completely honest with you. So what can you do at this time to start preparing, to be as prepared as possible in the event that your program does get to proceed this spring? There are a few things that I think that are most important. If you haven't already, start to understand the COVID-19 guidance at your host country. So if you haven't looked into it yet, it's really important to take a peek at the CDC and understand what the CDC health level notice says for that country. take a look at the State Department travel advisory and see what the State Department says with respect to travel to that country. Also, a quick Google search can tell you pretty quickly what kind of mandates and requirements are in place. If there's a mask mandate, if there is freedom of movement restrictions across certain towns within that country, specifically in the UK and in Ireland. There's some towns that are a bit more locked down than they were a couple of weeks ago, and those would certainly be locations that would be off limits to our students while under lockdown. And so these are the kinds of things that we want you to start associating and familiarizing yourself with, just so you're not trying to download all this information all at once later this fall. Next, understand the types of resources that are going to be available to you. I'll talk about some of the emergency assistance resources that are available to you on the next slide, but currently you are very familiar with your study abroad program directors that have been assisting you and will continue to support you until your departure, but also the local university, organization, or provider can also be a wealth of knowledge and resource to you. So if you haven't been connected with them previously or up until this point, let your study abroad program director know that you have specific questions for this program provider, and if there's anything else we can do between now and then to get you the answers to your questions, we're happy to do so. So we want to just be able to connect you with those resources so you know what they are before you arrive. Also at our global gateways and centers, if you're studying abroad there, you'll be very familiar, hopefully very soon if you haven't already, with our local staff that are excellent resources to you. So something to just keep in mind as we move forward with our planning and preparation for spring 2021. And the next thing, I think, when it's time for you to do so, if you haven't already, is to complete your health information questionnaire as thoroughly as possible. This was not only very important before COVID times, but it's even more important nowadays. We want to be in the best position to support all of our students with any sort of health challenges that they might have. It could be a learning disability, a physical challenge, mental health consideration, anything like that with prescription drugs that you might need assistance with. We want to know so we can support you. And if you're at a higher risk to contract COVID, we want to also be aware of that too, so we can better prepare you and shield you from that during your time abroad. So that's really important for us, and we want you to make sure that you complete that as thoroughly as possible and as honestly as possible, because again, it's just to support you the best that we can. When available, we want you to complete your online training. All undergraduate students need to complete a Travel Safety 101 course that's available on Sakai, but there will also be a very short online training that's COVID-19 specific. So like you completed your back to campus COVID-19 module, you'll have something very similar that with an international lens to complete before your spring departure. Again, we want you to ask a ton of questions. I am never going to refuse a student that has questions, no matter how many questions that they have. We want to make sure you're as comfortable as possible and as informed as possible before you go abroad. Preparation is key, and when students are prepared and as informed as they possibly can, the likelihood of our students having issues when they travel just goes down exponentially. And so to put your best foot forward, don't be afraid to ask those questions. You have plenty of people in Notre Dame International and beyond that are happy to answer them. And then lastly, just a reminder, we just want you to take your preparation very seriously. Before COVID-19, you could hop on a plane as long as you had a passport and you had your things with you packed and ready to go. It was much easier. Now it requires just a lot more preparation and thoughtfulness to make sure that you're mitigating your personal health and safety risk as much as possible. We want you to have a fulfilling and enriching semester abroad in the spring, fingers crossed. But the way to do that and get off on the right foot is to just make sure you're taking the preparation, the pre-departure orientation, seriously. You get an email from your study abroad director that you should go in and e-sign some documents or complete your online training. Go ahead and do that right away. Don't leave it to the last minute. So that way, if you do have questions, we can answer them and give you those answers well in advance and not at the very last minute. Anything that waits to the last minute is always bad news. It never goes the way that you want it to. So again, please take it very seriously. And then the last topic here is emergency assistance abroad. If you have an emergency, how does the university support you? What are the resources that are available to you? And so to best support you, Notre Dame International, we partner with the best in the business. And so there are two things I want to point out here: insurance and assistance. So I mentioned GeoBlue already. GeoBlue is, again, Notre Dame's preferred international insurance provider. And we've been partners with them for quite a few years, and they've been great partners. So specifically, again, it's an insurance company. They tell you what is covered and how things get paid for. That's how things get paid for, is that they facilitate those payments. They cover 100% of medical costs overseas, and they also cover evacuations. I do want to point out here that they need to be coordinated by GeoBlue. And so with that, if you need to see a doctor overseas, always consult with International SOS, which I'll talk about in just a second, or GeoBlue, so you don't have to pay any out-of-pocket costs. If you go to a GeoBlue provider in their network, which there are plenty of them, you can walk in and not have to pay any sort of deductible. And if you do not, and you go to a provider outside, you might have to pay up front, but then you can seek reimbursement afterwards. But again, they do cover 100% of the cost. It just makes it much easier for you if you go to a GeoBlue network provider. Speaking of evacuation coverage, they do provide coverage for medical and security evacuations. Medical evacuations could mean that you had a serious accident that required a hospitalization, and you're in a country where the standard of care is not where we are comfortable with for your treatment for your serious situation. What would happen is you would be medically evacuated out of that country to a medical sector of excellence. So it could be in South Africa, it could be in Singapore, it could be in London, it could be back in the United States. It's really dependent on your location in the world and also the severity of your medical emergency. For security evacuation, this could be for political, security, natural disaster reasons. If there's an earthquake and all citizens are told to depart the country immediately, something like that will be covered. If there's a coup in a country that you are studying in and it's stated that everybody should depart, those are the types of things that will be covered. I will just want to point this out very quickly, is that pandemics are a non-insurable risk. And so when our students were told to come home earlier this spring, that was on the university's, at the university's expense, and something that is not covered by the vast majority of insurance companies. So just keep that in mind, that the university did support our students this past spring, and since then, with borders being closed, the State Department has provided repatriation flights where commercial operations for flights have ceased to exist. But the State Department is not going to continue to do that forever. So that's something to keep in mind for all of us, and especially for Notre Dame International, for planning purposes. If there's even the hint that commercial operations could cease or something could terribly go wrong, we're monitoring that very closely and would immediately inform our students if there was any sort of major decision that was made. So just something to keep in mind. GeoBlue, again, a great partner of ours, they offer telehealth and virtual counseling sessions now via an app, which is really great for COVID-19 times. If you have a stomach bug and you're not quite sure what it is, especially if you don't want to go into a physical doctor's office with everything that there is going on here, you can have a telehealth appointment, similar to, I think, what is occurring here on campus a bit, and also virtual counseling sessions. And so those are also available to you, and even beyond COVID times. Second is International SOS. They are a medical and security assistance provider. And this is how you get the support you need. So GeoBlue, again, is the insurance, how things get paid. They're how you get the support that you need. And so with that, they have a network of over 84,000 vetted providers worldwide with medical and security and logistics on demand. And so with that, it's a one-stop shop. You can download the app, which we're going to talk about in our pre-departure orientations later this fall. This is extremely important because the app serves as a multifunctional hub for you for any sort of medical security emergencies, and also for us to communicate with you in a very quick manner. So by downloading the app, you can call them with a touch of one button. You can receive alerts that are medical security related for your program destination, and also receive emergency communication from the university. All of your itineraries are fed into our travel tracking system, and so that is how we know where our Notre Dame travelers are at any given time of day and any place in the world. And so with that, you know, we, in the aftermath of a major emergency, or if we need to communicate with all of our students all at once, those are pushed through that app via email and also via text. So we'll talk about that more as the fall semester goes on with pre-departure orientations, but just know that these are your two key resources for any sort of emergency situation, medical or security, and we'll continue to orientate you through this within the remainder of the fall semester, but just something to touch on here briefly. We're coming down to our question part of our presentation. And so again, if you do have any questions, please use the chat function. But here are just a couple that we've been asked recently and thought we'd kick it off with just these couple of questions. So if a country requires a 14-day quarantine, is NDI going to cancel that program, or will they offer students housing to stay in for that period of time? This is a very interesting question, and it's not a straightforward answer because every program is different and every country is different. So in some countries, we might not have any control of where you quarantine. In some countries, you have to quarantine at a government facility or a hotel that they designate, and it could be at the traveler's expense. That's something, again, in our risk assessment, we weigh and will help us make that decision. But in other locations where those restrictions are not in place, for example, like in the UK or in Ireland and some of our other provider countries, you can quarantine at a place of your choosing. And so, for example, in London, you could quarantine at Conway Hall. So it's really program specific. We're not going to completely rule out programs because of this, but it depends really on the country, the restrictions in place, and how we feel holistically about your health, safety, and personal well-being during that time period. The next question is, if a vaccine is available, will GeoBlue cover the cost of immunization? So GeoBlue does not start to cover you until your itinerary starts. So the date of departure, and then it ends when you leave the country. So GeoBlue typically does not cover the cost of immunizations. So that's really important. You're expected to have your immunizations before you leave. However, with COVID and how things change, you know, day to day, week by week, you know, there's the possibility that this policy could change with GeoBlue. It's just something that has not been indicated to us because there is not an immunization yet, and so there's not been a policy statement made on this. GeoBlue will cover your costs of medical treatment when you are abroad. If a doctor, just like here in the United States, says you have these symptoms for COVID, we want you to be tested, and they'll refer you for a test. Similarly, GeoBlue will cover those costs. However, GeoBlue will not cover the costs for arbitrary tests. So if you enter a country and need to be tested on arrival at the airport, that is at your personal cost. That's not at GeoBlue will not cover those costs because that's not medically necessary. It's just a necessary action based on that government's requirements for entry. So something to certainly keep in mind. Katie, are there any questions in the chat?
There was just one, but you actually already addressed it. It was about how the 14-day quarantines work.
Sure. Okay, perfect. Okay. I thought there would be a lot more questions. So hopefully I provided you with a lot of information about perhaps maybe questions you had. But again, if you do have questions that you think of later, my contact information is available right here on the screen. I'm happy, again, to answer any questions you might have, or if you feel more comfortable going to your study abroad director, please feel free to reach out to them and they'll bounce your question over to me. Again, we want to be just, very helpful for you during this process. We want to be as straightforward and honest with you as possible. But we do very much believe that study abroad could still be a very enriching, rewarding educational experience for you this spring. And I hope you have a little bit more information now about how the university makes those decisions and the kind of care and consideration that we are taking in this very important process at the country level, at the program level with our providers, and just making sure that we have the highest level of confidence that your personal health and safety will be well looked after during your time abroad, and that if something does happen, that the appropriate protocols and emergency plans and support is there readily available for you in your time of need. So with that, I will conclude our presentation. Again, thank you so much. Yeah, Katie.
We had two more questions come in. They're actually questions I can answer. One was, if the programs get canceled in the spring, will students be able to apply for next fall? The answer there is a little complicated. So we are going to work with you as much as possible to try and accommodate you on a summer program, a fall program, depending on all the different, how everything's going with COVID, of course, and then just space and all of those things. But the thing to note is a lot of students at that point, well, are juniors when they're studying abroad, so would be seniors. So it also really depends on if your academic department is going to be willing to approve you to study abroad as a senior. But we are going to work with you as best we can. The other question is just about Study Abroad Week events and whether they've been recorded. Yes, most events have been recorded. We did not record the program advisor Q&A sessions because those were just open advising. We also did not record the influencer tell-all sessions because, again, that was open Q&A. Everything else has been recorded. If you'd like to meet with an influencer, you can also contact them directly. The recordings are on the video page of the Study Abroad Week website.
Wonderful. Well, thank you so much for your time and attention, and we hope to hear from you soon with any questions you might have. Just let us know if you need anything. Thank you very much.
Thank you.